very first startup pitching for you today. We'll continue right on to the second startup. Please give a very, very warm welcome to our second startup here today, CMED.
Hello everyone, my name is Moinul Haq Chaudhry. I am here to present you a presentation on CMED, an architecture that's been designed and developed in Aimslab United International University. Death. We all know that it's inevitable. Yet we try our hardest to slow this down as much as we can by creating hospitals, by providing healthcare services. However, in Bangladesh, the healthcare services are not at the mark. There are a lot of people dying every year due to lack of healthcare and awareness. One of the major causes for these deaths is non-communicable diseases, NCDs that we call, the diseases that kill you silently and slowly, like diabetes, hypertension. A new report actually came out from Bloomberg that showed some staggering information. 67% of the death that happen in low and middle income countries happen due to NCDs. Surprisingly, only 1% of those health funding is addressing that. When we look at Bangladesh, the deaths due to NCD is 59%, and every year it's increasing. And the out-of-pocket expenditure is 67%. NCDs are not only affecting people who are dead, but also affecting people who are alive as well. It hampers our productivity and impacts our generation of revenues as well. Now the solution. Solution is pretty simple. It's preventive care. Research by Harvard University actually showed that 9 out of 10 strokes can be prevented if you provide regular health monitoring. It also shows that knowing your vitals can reduce your health risk and health costs by 5 times. And this is where we come in. CMED provides IoT-enabled smart preventive healthcare solution, which is easy to use, which is cheap, accessible, and follows a sustainable development model. Now, what do we offer? We provide services that are key markers. We measure vitals in one word, and these vitals are key markers for the main apostles of NCD: diabetes, obesity, and hypertension. We monitor your health. We generate health records, which in turn helps us to provide health risk prediction for you, and we provide ubiquitous access to your data and doctor's consultation if required. Our CMED bag comes with the devices, an app, and all other screening materials. The CMED system works this way. We have medical-grade devices that are connected to the cloud using a mobile phone via our AI-driven smart health application. We can generate reports, and you can share it with doctors or your friends and families as well. Preventive healthcare is important, and everyone needs it. That's why our target customers are over 160 million, generating us a SM market size of $2.4 billion. We are currently focusing mainly on B2B customers, providing services in a volume-based subscription model. Currently, we have 2 different channels. First one is Worker Wellness Program for corporate houses and factories, and second one is Student Health Wellness Program for students. Actually, in future, we are planning to bring a B2C channel as well, which is Home Health and Wellness Program. Currently, we have 2,000 customers who are paying a very nominal $1.5 service charge, earning us $3,000 revenue per month. In future, to reach out to rural areas of Bangladesh, we are introducing Smart Shastakarmi model, which is basically creating entrepreneurs who can be local health community leaders. And our prediction shows that it can generate up to $3.7 million revenue per year. So far, we have provided over 30,000 measurements on 5,000 people, and this has generated us over $10,000 in revenue. And most importantly, we have impacted over 10,000 lives so far, and we're planning to increase that number over 100 million by the next 5 years. CMED provides features that nobody else are providing at this point, and at a very cheap cost. We have FDA and CE certified IoT-enabled medical devices that are connected to your mobile phone. We have robust software architecture. We have AI-enabled machine learning algorithm-used risk prediction softwares. And also, we have a very strong team that has a diverse background and strong work experience, ranging from research scientists to medical professionals to business graduates to software engineers. Our is a biomedical engineer who has over 10 years of expertise in healthcare sector. And I myself am a biomedical practitioner who has a biomedical informatician who has a business and engineering degree. Our paper was actually published in Elsevier. We are planning to get 100K users by 2018. So this is what we expect from Seedstars.
Much CMED. Well done. Okay. Jury, who wants to start with questions?
Yes. Thank you, Moinul Haq. I wish you success. And actually, this is a very important theme for Bangladesh peoples. And just you tell, what is your competitive features? This low-cost competitive features. This is low-cost, better service, or premium price, better service?
Low cost, better service.
Okay, thank you.
Because the main idea here is to provide service to everyone in Bangladesh, and so that people can afford it and can reduce and can take the preventive measures so that they can actually control non-communicable diseases. That's why we are providing services at a very low cost and at premium features.
I think you will be continue it. Otherwise, we saw that after when it will be big, then you will be get more benefit, more profit. This will be, you remember that you will get low profit and better service.
Yes, we are actually going for volume rather than the premium prices.
Okay, thank you.
So,
Wish you success.
Thank you.
First of all, congratulations on the presentation. It's a very good project, and you guys are doing something good for the country. So I wish you all the best. I have two questions. First is
Adrian, I don't. Go ahead.
First is, who do you consider your main competitors? And secondly is, where do you see your main focus, on the hardware side or the software and servicing side?
Okay, that's a very good question, actually. Initially, we tried to provide services on both the hardware and the software side, but we actually designed this hardware in Bangladesh, and we actually tried to produce it here, but the quality was not up to the mark here. That's why we actually went in partnership with this Silicon Valley company to produce our devices and actually provide them here. And the software side is completely done in Bangladesh by our software engineers who have really great experience in that place. In terms of competitors, at this point, the service that we're providing, nobody else is providing at this point. But in future, there could be some companies like telemedicine companies that come to provide this service. What we're actually expecting is that this market is huge. We alone cannot actually provide this service at this point. So we actually encourage people to come to this market and actually provide healthcare services for everyone.
Is it on? Yeah. Yeah, so the services are definitely a great advantage you have. However, what I also want to know is, do you have your products patented, or is there anything how you protect them?
Yes, we have already applied for the IP. It takes a long time here, around 18 months. But we have already applied, so it's going to take around a year to get the IP done.
Hello. Thank you very much for your nice presentation. Many companies are giving the same type of service, as for example, Square or different organizations. And how do you differentiate your service and their service? But, let me finish. Another is most of the people in Bangladesh don't consider health as a much more important thing than any other things. So how do you reach the general people with your costing and service?
Okay, that's a very good question. I actually wanted to incorporate in the presentation. Glad that you asked me that question so that I can answer that. So for the first one, we are providing features that actually Square or other healthcare services cannot provide at this point. We are allowing them a measure at a very low cost and allowing them to get the preventive healthcare solutions. And we also have the unique devices and software architecture that no one else at this point in the market has. And speaking of the other one, this is what we actually came to Seedstars for. This is a problem that everyone needs to be aware of. Nobody knows that how NCD is affecting the people and how it's creating a massive impact on our social and economic structure. we are coming here to meet with you people who are change makers, who can actually introduce us to other people and create the awareness everywhere. That's why we're actually going to B2B, because in B2B, you can actually go to a few people, make them understand what the problem is, and create a change everywhere. This is why we are here. This is exactly what you guys can help us with to get the exposure, because the biggest challenge, the problem we're trying to solve is having people know about what the problem actually is. Thank you.
Thank you so much, CMED. Good job. Okay,
All right.
I'm gonna steal the clicker from you.
All right. Awesome. Thank you.
Thanks very much.